the name of Allah, who is most gracious and the most merciful. Myself, Bisma Shahid from BS Biochemistry Department. Today I am here to represent the topic of chemistry like CBD oil and other phytochemicals in cannabis. Contents: History, Introduction, Formula, what is CBD oil, medical uses, effects, and benefits. History: Nearly a century after a scientist published his study, Advancement in Research and Technology revealed the presence of compound within the cannabis plant. The first discovery of an individual cannabinoid was made when British chemist Robert S. Sahn reported the partial structure of cannabinoid, which he later identified as fully formed in 1940. 2 years later, American chemist Roger Adam made history when he successfully isolated the first cannabinoid, cannabinol. His research is also responsible for the discovery of tetrahydrocannabinol. Introduction: CBD, an abbreviation of cannabinoidal, was the first discovery in 1940 by Roger Adam. He isolated both CBD and other cannabinoid called CBN, cannabinol, from the hemp plant and hypothesized about the existence of psychoactive chemical tetrahydrocannabinol. It was not until 1964 that THC was isolated by Raphael Mechoulam, one of the leading names in cannabis science. It was through Mechoulam's work that stereochemistry, the 3D molecular formula and properties of both CBD and THC were identified. The formula of CBD, and then I'm moving toward the endocannabinoid system. The endocannabinoid system is a unique communication system found in brain and body that affect many important functions. It is made up of natural molecules known as cannabinoids and the pathway they interact with together. These parts work to regulate a number of activities including mood, memory, sleep, and appetite. All cannabinoids produce effects in the body by interacting with cannabinoid receptors, which form part of cannabinoidal system. The body produces two receptors, CBD1 receptors and CB2 receptors. CB1 receptors are present throughout the body, particularly in brain. They coordinate movement, pain, emotions, mood, thinking, appetite, memories, and other functions. CB2 receptors are more common in immune system. They affect inflammation and pain. THC attacks to CB1 receptors, but CBD stimulates the receptors so that the body produces its own cannabinoids known as endocannabinoids. What is CBD oil? CBD is one of many cannabinoids compound in the cannabis plants. Researchers have been looking at the possible therapeutic uses of CBD. Two of the compounds in marijuana are delta-9 tetrahydrocannabinol and CBD. These compounds have different effects. Until recently, THC was the best known compound in cannabis. It is the most active constituent and it has a psychological effect. It creates a mind alerting high when a person smokes it or uses it in cooking. This is because THC breaks down when a person applies heat and introduces it into the body. Medical uses: natural pain relief and anti-inflammation properties. Conventional drugs can help relieve stiffness and pain, but some people see CBD as a more natural alternative. Non-psychoactive compounds in marijuana such as CBD could provide a new treatment for chronic pain. Quitting smoking and drug withdrawal. Smokers who used inhalers containing CBD smoked fewer cigarettes than usual and stopped craving nicotine. This suggests that CBD may help people in quitting smoking. CBD helps reduce craving during withdrawal from tobacco because of its relaxing effect. Specific cannabinoids such as CBD may help people with opioid addiction disorders. CBD reduces some symptoms including anxiety, mood relax symptoms, pain, and insomnia. Epilepsy. They approved it for treating the following in people aged 3 years and over: Lennox-Gastaut syndrome, Dravet syndrome. These rare form of epilepsy involve seizures that are difficult to control with other types of medications. Alzheimer's disease and other neurological symptoms and disorders. CBD may also help treat complications linked to epilepsy such as neurodegeneration, neurological injury, and psychiatric diseases and anxiety disorders. Effects. Possible effects include liver damage, interaction with other drugs and alcohols, changes in alertness, which can make driving dangerous, gastrointestinal problems and loss of appetites, mood change including irritability and irritations, a reduction in fertility for males. How to use CBD? Ways of using CBD products include mixing them into food or drink, taking them with a pipette or dropper, swallowing capsules, massaging a paste into the skin, spraying it under the tongue. Benefits. CBD may benefits a person health in various ways: chronic pain, arthritis or joints pain, and anxiety, depression, sleep disorders, migraine, cluster and other headaches, PTSD disorder, nausea, cancer. Thank you. Allah Hafiz.